Hi, my name is Matt Rettig. I'm a genitourinary medical oncologist. I work at the David Geffen School of Medicine at UCLA, also known as UCLA School of Medicine. So, what are the recommendations for family planning and fertility planning for testicular cancer patients undergoing chemotherapy or radiation? So I think it's important to recognize that testicular cancer is the most common cancer amongst men ages about 20 to 40. So fertility is a really important issue for such men who are typically partnered with women of childbearing age. So first of all, when a man is diagnosed with testicular cancer, and when we're talking about testicular cancer, we're talking about the germ cell tumors. There are rarer cancers that arise in the testicle that are not germ cell tumors. There are stromal cell tumors. There are lymphomas that occur. The lymphomas tend to occur in older men, and lymphoma is actually the most common cancer of the testicle in older men. But in younger men, what we're talking about when we say testicular cancer is a germ cell tumor. So when I say testicular cancer, for the purpose of this response, we're really talking about germ cell tumors. So first of all, it's important before a patient receives any treatment that that patient receive counseling regarding fertility and sperm banking. So patients may have infertility associated with testicular cancer before they start any treatment. So there are two main reasons for that. First, a patient with testicular cancer is often found with a syndrome called testicular dysgenesis. What this means is that there are a constellation of other findings associated with or affiliated with or concurrent with the testicular cancer. And these include something called hypospadias, which means that the opening to the urethra where urine and semen are discharged is at the underside of the penis. That's called hypospadias. The next phenomenon is something called cryptorchordism, which means that one or both of the testicles have not descended into the scrotum. They can be found in the abdomen even. And poor semen quality. So that syndrome of testicular dysgenesis is associated with testicular cancer. So you can see that patients may have in this syndrome poor sperm quality and reduced numbers and motility of sperm. So that's one reason why a patient with testicular cancer might have an issue with fertility even before any treatment. A second reason is that even when testicular cancer arises in the absence of that syndrome that I just mentioned, testicular dysgenesis, the testicular cancer is actually associated with decreased sperm counts, despite the testicle on the other side being normal. And what's interesting is that when patients complete therapy, the sperm counts may improve and even normalize. So that's important to keep in mind. So it's important to consider sperm banking and fertility counseling before one starts any treatment. Interestingly, only about 30% of men who have testicular cancer undergo sperm banking, and only 10% of all men who have testicular cancer ultimately use the banked sperm to father a child. So infertility can also occur as a consequence of therapy. And that therapy can be surgery, radiation, or chemotherapy, all of which can be used for early stage disease. So let's start with surgery. The initial surgery for testicular cancer is removal of the testicle, which is called an orchiectomy. And that itself is associated with decrease in sperm counts. There is also a procedure called a retroperitoneal lymph node dissection, or RPLND, which means removal of the lymph nodes in the abdomen, and that can be used as part of early stage testicular cancer treatment as well. That particular procedure actually affects fertility not by decreasing sperm counts, but because it affects the ejaculatory function, where instead of sperm moving forward to the outside world, the sperm undergo retrograde ejaculation, basically into the bladder. Obviously, that is not consistent with fertility, and that can happen in about 10 to 20% of patients who undergo that surgical procedure. And then there's radiation therapy. So the radiation therapy can cause infertility, even though the testicles are shielded from the radiation. It's not perfect, and it depends upon the dose and the field, how much of the body is receiving radiation. And that varies depending upon the specific stage of the testicular cancer. And finally, there's chemotherapy. So chemotherapy for early stage testicular cancer, which is what we're talking about here, is generally only 1 or 2 cycles of chemotherapy. And the vast majority of men who have normal sperm counts prior to chemotherapy will have their sperm counts recover back to normal after chemotherapy. Although we're not specifically discussing advanced testicular cancer, that is associated with more chemotherapy, more cycles, higher dosages of chemotherapy, and in turn, patients with advanced testicular cancer have a higher risk for long-term infertility. So when patients have testicular cancer, counseling with the urologist or an endocrine reproductive specialist is really critical, and a consideration of sperm banking should be made. Finally, even when patients are undergoing chemotherapy, there is an important caution, especially if the patient has a partner who is a female of childbearing age, and they are actively having potentially procreative relations. So while patients are on chemotherapy, a barrier method of contraception is critical. 1, to protect the woman, and 2, to potentially protect the fetus. So while patients are on chemotherapy, there can be genetic changes in the sperm that can be teratogenic, meaning it cause abnormal fetus to develop. Now, I tell patients to continue a barrier method of contraception, not only during chemotherapy, but for 6 months after chemotherapy. Beyond that time point, there is no increased risk for birth defects in the offspring of the fathers who have received chemotherapy for testicular cancer. And the 6-month time frame is very conservative and probably a little bit more than enough, but that's what I recommend to my patients. So fertility and family planning is very important for patients with testicular cancer, not only for early stage, but also advanced stage testicular cancer. And a conversation with your urologist or reproductive endocrinologist is really critical. So that's my overview of the management of fertility in early stage testicular cancer.